Kimberly here. Today I'm going to talk a little bit about the sedation options that are available for dentistry. I always start off with meeting the child first, whether it's for a consult or a cleaning, whatever that needs to be done if they're in pain, and just kind of feel them out and see how they do with us. Every kid I feel like is a little bit different. Some of them respond differently to different approaches. So I think it's really important to just kind of learn how they react to decide whether we need sedation and what type of sedation we would use. I think the next step is to talk to the parent and give them my thoughts and opinions on whether we even need to use sedation at all. Some children can handle the work without doing any sedation, which is awesome. We just let them watch some TV, we numb their mouth, and then we do our work and they rock it out and they're good to go. Most kids are pretty receptive, I've found, to the laughing gas, which is just a little candy nose that sits on their face. They breathe that while they watch some TV. Once that kicks in, it just helps to relax them a little bit, and then we're able to walk them through and get the procedures done. The nice one about this one is that we flush all of the laughing gas out of their system before they leave, so there's no residual once they walk out the door, other than the fact that their face is numb. The next option for sedation is an oral sedation. It's where the kids come in first thing in the morning with nothing to eat or drink. After midnight the night before. They drink a little liquid. It tends to make them super loopy, a little unstable. At that point, we usually do that with a combination of the laughing gas. We do still have to numb their teeth for this one. We do suggest after that they stay calm, sit on the couch, have a parent or guardian with them the rest of the day, because they can be a little tired, that type of thing after the procedure. So it's important for them not to do any sports and just to take it easy for the rest of the day and let that sedation sort of wear off. The final sedation is the one with the pediatric anesthesiologist that we do here. That one is great because we know that we're going to be able to get all of the work done in one appointment. The anesthesiologist will come in, our children breathe a little laughing gas just to help relax them. They will put a little IV in. Once the IV is in, they are completely knocked out at that point. So then we can do all of the work in one appointment. We don't have to numb them at all, which is wonderful. So they can wake up, you don't have to worry about them biting their face, chewing their lip off, all of that good stuff. We get everything taken care of, and then they're good to go. I think another question that we get is who's a candidate for sedation? That's an easy answer and a complicated one all in one. I think anybody is in theory a candidate for sedation. Most people can do the laughing gas without any problems. Once we start talking about the liquid that the kids drink versus the IV sedation, there's a little bit more screening process that goes into it as far as taking a full health history, making sure their tonsils aren't enlarged, their breathing is good, they can breathe through their nose well, they don't have sleep apnea, all of that kind of stuff. But we always review that with the parents before we do any type of sedation, make sure if we need to check with their pediatrician and all of that good stuff before we make a call on whether they are a candidate for sedation or not. If you guys can think of any more questions for me for sedation, please feel free to give us a call.